Hey guys, Greg here, and I'm back with another video. In this one, we're going to be discussing the foot and ankle. But first, let's jump into some of the bones that comprise the ankle. We have the fibia, the tibula, and the talus. So the talus is actually going to connect the ankle to the foot. The tibia, or shin bone, is going to be predominantly responsible for carrying most of the body's weight, carrying most of the body's load. And we also have the fibula. Now, in comparison to the tibia, the fibula is going to be much smaller in comparison, but this bone is going to work as another supporting structure along the lateral side, the outer side of the ankle. And from there, we can move on to the calcaneus, which you may know as the heel bone, and plays a big role in load bearing, right? So that calcaneus bone is going to be largely responsible for weight bearing, load bearing, and shock absorption. Then we also have the tarsals. The tarsals are located in the midfoot. These are going to be cuneiform bones. Then we move into metatarsals, and these are going to be the 5 longer bones that connect the midfoot to the toes or to the phalanges. We have these flanges. These are going to be the bones that comprise the toes. Incredibly important for stability, incredibly important for dexterity. Some common movement flaws often associated with the foot and ankle can include things like overpronation. That happens when the foot gets essentially rolled too far inward, too far to the midline. On the other end of the spectrum, the foot can also suffer injuries from excessive supination, with the foot getting turned too far outward or too far out towards the lateral side of the body. Another big one that I've come across lately is limited dorsiflexion, right? So limited ability for the foot and ankle to have upward mobility. Also, muscle imbalances. There's a lot of different things that affect the ankle and foot. If certain muscles are imbalanced, if certain muscles are too weak, if certain muscles are too tight, all of these in a culmination affect the way your foot works. It has the potential to pronate the foot slightly, supinate the foot slightly, give you difficulty with dorsiflexion. And another thing that we sometimes see with dorsiflexion is ankle eversion. And that's essentially when the foot wants to rotate outward, rotate more towards that lateral line, as the ankle attempts to rotate upwards with dorsiflexion. The posterior tibial tendon. Weakness in the posterior tibial tendon can cause arch issues. Ligament laxity. Again, we see that in a lot of overuse injuries or repeated sustained injuries. Now, some of the drivers behind these different movement flaws can include a lot of different things. Ligament laxity. Ligament laxity often comes from repeated injury, similar to kind of what we see in the shoulder region. The more we injure some of these muscles and injure some of these ligaments in particular, the harder it is to re-strengthen these ligaments and get laxity back in the ligament. So you may be wondering, what are some exercises that you and I can do to promote the longevity of our feet, right? The health of our feet, the dorsiflexion, the mobility, um, the laxity, the strength. What can we do to keep all of the things healthy about our feet? Well, obviously, we can stretch them. Stretching them is a great way to promote health. We can exercise. And there's one particular movement that I like to do, and I do it regularly. And you can take a tennis ball, and you can do this at home, you can do this at the office, you can do this, well, you might not want to do it in your car. But the point is, with your shoes off, just begin rolling your foot between the floor. Just begin rolling that ball between your foot and the floor. And it may feel a little different at first, and you can just start gently. And then as you get a little bit more comfortable with it, you can increase the pressure. And what we're really trying to do here is we're just trying to start to stimulate circulation. We want to get the blood moving down there, get that foot warmed up, get the blood moving around. And circulation is essential for your foot. Get the blood flowing through all the muscles. And if you've ever had the unfortunate experiencing of suffering plantar fasciitis, terrible experience, rolling that tennis ball beneath your foot can be incredibly beneficial in combating plantar fasciitis, and it can also offer some relief from plantar fasciitis. Hi, now I'm just going to take a moment to demonstrate a couple different ways that I like to use a tennis ball as a tool to facilitate stretching and also to facilitate circulation. And it's really simple. I just set it on the floor, and I can use this tennis ball in a multiple of different ways, right? I can take the phalanges and just wrap them around the tennis ball and just get a good stretch. A good stretch from the phalanges to the midfoot. And I can pivot a little bit and just get a good stretch across the toes. And then I can transition into a little bit of rolling, some light rolling here. From the phalanges, calcaneus, metatarsals. And then as I begin to get more comfortable, I can apply more pressure. And this will help facilitate circulation. And it also feels good. And you can get into the arch. And really just assist the blood flow, assist the circulation. Thank you. So obviously there's a lot going on in the foot between the intrinsic foot muscles and obviously getting into the gait cycle. Understand the gait cycle as getting more into stability, balance, propulsion. How are we actually making contact with the ground? us? How are we actually striking and moving forward, right? So when it comes to the gait cycle, we're getting a little bit into adaptation. We're getting a little bit into shock absorption. And again, how are we striking the ground beneath us? How are we um, really going through that cycle of propulsion and moving ourselves forward? So the foot is unlocked and kind of able to pronate, which allows for shock absorption and conformity to uneven surfaces. Stability also plays another very important role in gait. Um, Obviously, stability being very important. We want to be able to have a good base of stability for that push off phase by supinating to transmit rotational forces for forward movement. And then obviously as we have forward movement, that's going to facilitate propulsion, which is essentially your foot and ankle pushing the body forward or driving the body forward. So that's a little bit of my familiarity with the gait cycle. Um, but I think seemingly my biggest takeaway from this particular module um, was kind of the posterior chain. And what I mean by that is how these lower back issues, maybe some discomfort in the lumbar spine, maybe I've got something going on with my hip, maybe I've got something going on with my knee, uh, can seemingly all be tied to your foot. So interestingly enough, you can have some complications going on in the foot, whether that be in the midfoot or metatarsals. Uh, you can kind of see the foot as the root cause, but may not necessarily know it, and you're suffering from these low back, knee issues, hip issues, and you're having all these other issues, and it could be caused by something in your feet.